Welcome to the HR Empowerment Podcast, where we will uncover strategies and new insights from HR professionals who discuss up-to-date regulations, best practices, and the most pressing topics like diversity and equity, leadership, dealing with difficult situations, and much more that affect your bottom line and business. Thanks for joining us.
Hey, everybody. Welcome back. Wendy Sellers here, the HR lady, with my co-host, JC.
Hi, Wendy. How are you?
I am fantastic. I am having some technology issues, which you're helping me through. I think we all go through this at some point. You know what other kind of issues I'm having? Nutrition issues. I really am. I've been trying different foods and I'm like, nope, don't like that either.
I'll tell you what, it's just a matter of making some simple choices. And I don't know, I read it somewhere once. Suck it up, Buttercup. Isn't that right, Wendy? Oh, that's your book.
Funny.
That's your book.
That's right.
Okay.
Suck it up, Buttercup. Get over it. No, actually, what we're really going to do is we're going to get some real advice from an expert in health nutrition. Where our guest today is Michelle Shepard. Hey, Michelle, how you doing? Welcome back.
Thank you so much for having me. I am doing wonderfully today, Wendy.
Hey, we want to talk to you or have you educate us actually on, personalized nutrition, and so that we can continue to have a positive, or start in some cases, a positive and healthy relationship with food. Talk to us, our listeners are mainly HR people or those with the HR hat on. Talk to us about how having health nutrition coaching or classes or some kind of education in the workplace can, in the end, help the company's bottom line by cutting costs on healthcare.
Oh, this is one of my favorite topics. And I swear, aside from HR, everyone else's eyes just glaze over when I talk about it. So I'm so excited to be here and just platform this, because so often nutrition and wellness programs get the dregs of the budget, right? Like, oh, we got $100 left over. Let's have a lunch and learn. But if you look at some of the statistics on having a really well-developed and ongoing wellness program, some of the stats are 3 to 6 months or up, give the best ROI, but it can save you thousands of dollars if you're a small business, and much more than that if you're a large business. So one of my favorite stats in the whole world out of the Harvard Business Study, and the one that they did, and it was a fairly limited program in what they offered, every dollar invested was a $6 return, right? So, and about 80% of that was solid savings, like tangible things like healthcare, medical costs, absenteeism, and the other in terms of productivity and output and outcomes. That's the best investment you could make in the market, right now, if you think about everything we're struggling with as owners. So just knowing that that is actually going to give you money back, as well as that engagement and culture piece, is so important. And when I think about the other piece, which is the biggest things in North America, so Canada and the States are super similar, especially in your management, your leadership, your executive teams are 35 plus peeps. Diabetes and cardiovascular disease, they're the biggest killers, but they're also the most expensive. $413 billion is the cost of care in the US. Billion, right? So we're losing money by not treating it earlier, right? Not engaging our employees on it. It's such a huge opportunity to get ahead in a market like this.
And how much did you say?
413 billion is the cost of care just for diabetes, not even for diabetes and heart disease, which would be the second one in the US alone.
Wow, that just blows my mind. I mean, we could definitely use that money on something else, like, I don't know, homelessness, helping veterans, paying off student loans, you name it.
Yes. Right? We just wait till it's too late.
It's crazy, too, because that's the cost in the U.S. And as we all know, things are a little bit cheaper in Canada. So if it's $450 billion here, it's got to be, I don't know, at least $100 in Canada, right, Michelle?
Maybe 105, something
105,
like that.
Got it.
Too funny, JC. And JC, by the way, really is on the border of Canada up in Buffalo, New York. So he wasn't kidding when he says, oh, I see Canada right at the end of the street down there. So thanks, JC, for your comedy hour over there. So
It's the least I do for international relations, Wendy. And by the way, while we're on the topic here, just so you know, there was a comprehensive review that was done of 56 published studies on worksite health programs, and they found that well-executed initiatives can actually yield significant 25% reductions in absenteeism, healthcare costs, workers' compensation, and disability management claims. Back to you.
What are your thoughts on that, Michelle?
Oh, it's huge. And I see this in my own corporate partners, and because they often start earlier. I'm lucky to work with often very progressive, teams, even in really traditional, like at a manufacturing client. And their executive team was like, they were in and they were working on it. But when you start earlier, in the 30s and the 40s and 50s with their teams on that wellness piece and that ongoing program, you're going to not just reduce healthcare costs, you're going to eliminate some, right? Diabetes is both preventable and reversible when we catch it early enough. And so having that in place as a really robust part of your program is going to be hugely beneficial for that bottom line. And if I think about even absenteeism, right? Like how much does it cost you every time someone is sick, both in covering them, but in lost work and lost opportunities? Just diabetes alone, a single diabetic employee has 3 times more absent days every year than a non-diabetic employee. And if you span that across our workforce, that's huge, right? And so if you could get that down to the baseline, you're both going to save money, you're going to have better retention, all the things that just make it easier to run your business, as well as obviously the people part is important too. But that bottom line is impacted by how we care for employees and their health at work.
Right. And not just passing it over in the United States specifically to the healthcare company, because they're not necessarily going to do it the way it should be done, even though they might want to. We have so many laws about privacy and everything like that that sometimes get in the way, even though they're there for good reasons. So this has been
similar challenges here. So lots of things are funded, which is great, but preventative care is very poorly funded in Canada because funding's limited, as all budgets are. But it really means that, I think workplaces in both countries really struggle with that. We're waiting until people are sick, and it's costing us money and time and lives to manage it.
Yeah, absolutely. Well, thank you so much for this. Hey, in our next episode, we're going to cover boosting employee engagement and morale. Wouldn't that be nice? And for our listeners, just a reminder that Aurora Training Advantage subscribers can earn HRCI and SHRM credits for listening to this series on the HR Empowerment Podcast channel. So go to their website, auroratrainingadvantage.com/podcast, and check out that information there. We'll be right back with episode 3 of 5 in this series of the benefits of offering health nutrition coaching to employees. Thanks for joining us.
Thank you for joining the HR Empowerment Podcast, brought to you by Aurora Training Advantage. We hope you've gained new insight and strategies to navigate the HR profession. We look forward to you joining us again on the HR Empowerment Podcast.